Good afternoon, and welcome to the Wednesday, November 20th Health and Human Services Committee meeting. The time is 1 p.m. and I would welcome everyone here today. I want to remind everyone that's around the table, just remember to talk into your microphones. We've had some technical issues, and I know that it's going to be probably difficult this afternoon to hear each other. But I do think speaking into the microphones, getting a little closer does help the sound situation. I wanted to see if there are any changes to our agenda today. Okay. We do have one person here that has signed a blue form for public comment. And if there's anyone else here that would like to speak on privilege of the floor for public comment, please feel free to fill out a blue form. We do have some rules for speaking under privilege of the floor. Number 1, I agree to a 3-minute time limit. Number 2, I agree not to raise my voice. Number 3, I agree not to use lewd, obscene, profane, slanderous, or libelous language, or speak or act in a manner that would tend to incite a breach of the peace. Number 4, I agree not to speak about county personnel matters. Personnel matters includes comments about the job performance of named county employees other than elected officials. Number 5, after 3 minutes, I agree to leave the microphone and yield the floor. Transferring time to another person is not permitted. Number 6, I agree to be courteous and not make comments, gestures, outbursts, or other disruptions while other members of the public or legislators are speaking. Number 7, I agree that if I cause a disruption and am asked to leave, I will leave the chambers. Our first speaker today is Amanda Kirch-Gessner.
Hello, there we go. All right, I'm Amanda Kirch-Gessner. I live in the town of Ulysses here in Tompkins County. I am self-employed through my own business, Organizing Potential, as an energetic organizational optimizer, and I am currently volunteering overtime with No More Tears based out of Henry St. John's here in Ithaca. I am here today to invite you all to come see our food distribution on Thursdays from 4 to 6. It'd be a great opportunity for you to connect with people who are volunteers. Everybody within No More Tears is a volunteer. Nobody gets paid. It's pretty remarkable when we look at frontline services that are truly accessible, virtually no barrier. The only barrier is that people need to ask, okay? I have learned more volunteering with them in my capacity as a life skills coach and community navigation assistant for a client who was recently displaced from our shelter. I've been talking with some of you, I've been connecting with many of you, eager to share my experiences for how many gaps our county government appears to have facilitated and enabled through having such an active care response from nonprofits to county services. It's really draining our resources. And I think it's really been illuminating simply through very basic conversations I'm having with county personnel, other outreach workers about what their barriers are. I mean, it amazes me. There's one person who works at DSS who I asked what would make their life easier. Simply introducing a couple more phone lines in the lobby so that they could better serve clients at DSS. Doesn't strike me as a particularly big lift, but it also surprises me that nobody has asked or that somebody in charge of DSS hasn't brought that forward to you guys. So like either management is overtaxed or I don't know. I'm a big proponent of just asking the people who work in these positions because they know what they need. They know what's missing. And I'd love to help you appreciate or see some of the experiences I've seen and witnessed, how incredible our first response is in this county to people who are actively in mental health crisis. Yeah, we have some incredibly brilliant, amazing civil servants, public servants, and I just want to make sure that they're getting proper recognition and also that their experience is being valued. We don't need more positions. We need people in positions like yours to actually just ask the questions and then help us realized solutions. So I will send out emails, but often I'm finding they're heading into spam. I don't know if that's an issue with your communications, but I know that it's happening to other people who email the legislature regularly. So please check your spam filters with frequency. I know that communications are being lost. Yeah, and please, I'll make sure that all of you have my information. Let's sit down, let's talk. I met with Lisa Holmes, Greg Measy, I've been talking to other legislators as time is available. But I know that we can fix this. I believe Mr. Measy said last night, maybe it's time we start asking for help from the people who are saying they want to help, and I want to help. Thank you.
Thank you, Amanda. Appreciate your comments today and yesterday.
In terms of emails going to spam, I would just maybe suggest that you email the legislature directly.
No, I do, and then, I've had that happen where, I email the emails on the website.
No, but to the address that is legislature@tompkins-co.org. And yeah, and then that will go to the clerks, and then they will send it to all the legislators.
Okay.
And we get them from them, yeah.
Okay, legislature.
That's it, right, Taylor? Yeah.
Thank you. Yeah, I think probably most of us have gone to our spam mail or our trash and seen some emails probably from months ago that should not have gone there. So good tip. Thank you for pointing that out. On to the chair's report next. Last night it was good to hear some of our nonprofits provide us with feedback. Obviously, the more conversations we have, the more feedback we have, the more that we can implement some of their ideas. I know that the shelter, whenever we were looking at installing the Code Blue shelter, we did not have much time. We didn't have great options. And so I certainly believe that we are doing the best with the resources that we have right now. My hope is that in the next year, 2 years, 3 years, we're going to have much better options and much nicer accommodations for people to stay in. I also want to make sure that I recognize the fact that nonprofits took their time on a Tuesday night to come to our meeting. And I think there's also something to be said about kind of going outside of the box and coming to our meeting and voicing concerns with the idea that those could have consequences. So I'm glad that people that were in this room brought those to our attention, and I hope that we're able to utilize their services. Also wanted to address a few, I think it was about 6 weeks ago, we had some concerns about an advisory committee that was supposed to, someone had mentioned an advisory committee that was supposed to report on DSS matters. And Administrator Lisa Holmes was investigating that and going to get back to us over the next few weeks in regards to when we were going to start that. We're trying to get the shelter off the ground, and then we're going to focus on that. So I did want to make sure to circle back around on that. I think that's all of my chair's report. I guess the last thing I wanted to say as we're coming upon the end of our year and kind of our time on HHS, I wanted to thank all of you for being on this committee. This committee is kind of a labor of love, because many times if something goes wrong in our community, we're the ones that hear about it. And so I appreciate the comments that have been brought forth to the committee, both by committee members and people of the public. And government is always a work in progress. There's never a point where I say we're doing the best work that we can do, because we can always do better. So I think it's up to us to push each other and to really try and listen to our constituents and listen to the feedback and really try and make things better for our community. So that's our jobs. Next is the county administrator's report, and I see Norma Jean that's here.
Hi, thank you. I have only one report, and that is the resolution that's been included in your packet related to the change or the request to change the opioid settlement fund contract for the reuse. And I see that Tim Page is here if you all have questions about those changes.
The resolution is request to amend Tompkins County Opioid Settlement Fund Contract, OCFC, ID 12897. And Norma, can you talk a little bit to the changes?
I will do my best, and then, and Samantha's here too to help, because she's been kind of tracking, she follows this along as well. But basically, we received a request from the Finger Lakes Reuse to change the way, when they submitted their application for the use of the opioid funds, there was a plan to have more apprenticeships and less kind of staffing oversight. It's turned out that they actually needed to redistribute, as you can, when you're starting a new program, a lot of times those kinds of changes happen. So they have identified that they need to have a coordinator, a little bit more administrative staff that needs to be covered by these funds. And so that's what this resolution is requesting, that shift. Unlike the Community Recovery Fund, we don't have a group that is another group to oversee this program. So we're bringing this to your attention. You're welcome.
Myself and Travis were part of the opioid task force, so we had reviewed all of the applications and awarded or provided a recommendation for this legislature to approve those awards. So, Randy, did you have a question or comment?
I saw Tim Page was here. I was wondering if you could speak to this a little bit.
Certainly. Thank you, Randy. Basically, the change is just to realign the awarded funds with the structure that was in the original application. Because we're working with vulnerable populations, these are people in recovery, we do need support for the supervisors of those folks and the location managers, and specifically the workforce coordinator, in order to make that program happen. The original application was also for a 3-year period. So when the award came in, it was for a sum of money that was less than the application, and it also removed some of the categories. And so me being new to Finger Lakes Reuse, when I saw that, we needed to, I assumed that it would just be apportioned the same way the application was, but with a smaller contract award. We found out through the process of vouchering that that was not the case. Thank you, Samantha. And so this is just trying to realign everything to what our goals of using these funds are. Thank you.
Thanks, Tim.
Thanks, Tim. Any other questions or comments on the resolution? Okay. Let's see here. We have 4 members in chambers, so we can actually, no one is on remote, so we could raise hands today. All those in favor, please raise your hand. That's 4-0. That passes. Thank you. Okay, let's see here. Next on our agenda is, did you have anything else for us, Norma? Any other report? Okay, thank you. I also see our county attorney is here. Maury, we can squeeze you in if you would like.
I do not have a report.
Next is the whole health department, and we have a few resolutions, and Frank Krupa is here as well. Hi, Frank.
Good afternoon.
And should we go ahead and do resolutions first? Is that all right with everyone? Okay. First resolution, whole health department nurse practitioner and psychiatry title, salary increase, ID 12870. Can I have a mover, please? Moved by Randy, seconded by Susan. Frank, would you like to talk to this resolution?
Sure. This is really just us trying to get the red line appropriate salary for the title of nurse practitioner. We have a full-time nurse practitioner, we have a part-time nurse practitioner, and we are recruiting for a nurse practitioner. And in order for all of that to work, we really need the title. to be at that salary. So we do have a full-time and a part-time person working in that salary, and we want to be able to recruit at that same salary. So that's the impetus for this particular resolution.
Thank you. Any questions or comments? Okay, let's vote on resolution 12870. All those in favor, please raise your hand. That's unanimous, that passes. And our next resolution, Resolution B for Whole Health, is Whole Health Department Psychiatrist title, salary increase, ID 12868. Can I have a mover, please? Moved by Amanda, seconded by Susan Currie. And can you speak to this resolution, Frank?
Yeah, so similar situation. We have a part-time psychiatrist that we were able to bring on board at the rate that you see in this resolution. There was some misunderstanding when we did the hire that there was somebody else in the county in that title, and the salary was already redlined to this level. So that was not the case, and it was discovered by HR and finance, and so we need to just actually redline this particular title as well to make sure that we can continue to pay our psychiatrist at the offered amount.
Budget adjustment, local health department, LHD, COVID-19 vaccine response. Health department, ID 12844. Can I have a mover, please? Moved by Susan, seconded by Randy Brown. And Frank, can you speak to this, please?
Yeah, this is just putting some remaining COVID-19 dollars on the budget books for 2024. The next resolution is essentially the same thing as well. There were 2 grants that we were provided. Those funds were not budgeted in 2024, and so we need to put those on the books so we're able to access them.
Okay. Any questions or comments?
Excuse me, I apologize. Can you please be sure you're a little closer to the mic? Rob is letting me know.
I love how I mentioned it at first, and now I'm the culprit. That's awesome. Okay. Oh, Amanda.
So this was money that was meant to be used. I guess I'm a little confused. For the period January 1st of 2021 through June 30th, 2024, but we're past that date. That's what it says in the resolution.
So we're putting the dollars on the budget books. The expenses have occurred. My understanding is there was an issue with getting the revenues recorded in the 2024 budget. So it's really an accounting mechanism.
Okay. What was the money used for?
That's a good question. We've done a lot of immunization outreach and education work. There's been ads in newspapers, on the radio and such around vaccines. We were able to use it for more than just COVID. So it was part of our flu messaging and such was covered under it as well.
Okay, thank you.
Okay. All those in favor, please raise your hand. It's unanimous. Thank you. And one more COVID resolution. Resolution D, budget adjustment, supplemental epidemiology, laboratory capacity, COVID-19 grant funding, whole health department, ID 12843. Can I have a mover, please? Moved by Susan, seconded by Amanda. And this is the same thing, Frank, as the last resolution?
Yeah, this one's a little bit different in that they extended the grant into 2024. And so we were able to use some funding into 2024 and needed to put that on the books as well.
Okay, thank you. Any questions or comments for Frank? Okay, all those in favor, please raise your hand. Then our last resolution, Resolution E, authorization to execute contract for primary prevention services, Whole Health Department ID 12896. Can I have a mover, please? Moved by Amanda, seconded by Randy. Can you speak to this resolution, Frank?
Sure. This is the second of three RFPs of the services that the Alcohol and Drug Council formerly provided. This is for our prevention programming. So the successful applicant was Cuyahoga, well, actually CARS, Cuyahoga Addiction Recovery Services, under affiliation with Cuyahoga Health Systems, in partnership with the Rural Health Institute, were the successful vendor in that RFP process, and will be receiving approximately $185,000 to do prevention services for the county. And so this is a approval as them as the successful vendor in the RFP process.
All those in favor, please raise your hand. Great, thank you. And Frank, would you be able to provide us with a report?
Sure. Happy to report a couple, well, happy on one front, not so happy on the other. First thing is we have opened our satellite mental health clinic at Brown Road. We've now been operational for a week and a half. We did a soft launch the Tuesday after Veterans Day. We have one full-time staff member up there and then part-time or staff that are working between both buildings. It is a soft launch. We didn't add a whole new team of people to take on this clinic. We're really just using both spaces to try to be more responsive to the needs of our clients. And so we're having to manage balancing staff needs, wants, and abilities to work in both places, as well as the clients that are interested in being seen at Brown Road versus down here at Green Street. So we're working through that in a soft launch, but any new patient that comes in for intake at this point is being asked which facility they would prefer to be served at. And so over time, the case of patients that'll be seen at Brown Road will continue to grow. So we're excited to finally have gotten those doors open. And so far, the folks that have come through have been really happy, both about the space as well as the location and alternative opportunities. So we're happy to report that that's finally underway. Shauna, you had asked about opioids and kind of the state of the county on that front. I would point anyone who's interested in opioid data to our webpage. There's quite a bit of information available there, both local data as well as state data. For 2024, the first half of the year, our opioid deaths, we had 13, which is fairly consistent with where we've been for the last few years. So obviously way more than we would want, but we haven't seen it continue to rise, which is a good thing. We've kind of plateaued, let's say. As far as overdoses in kind of more holistically, not just those that result in death, our calls for overdose and poisonings to the Department of Emergency Response have been higher for the first 3 quarters this year than they have been in the past. But the data that the state has around EMS determination and ED visits related to overdoses are declined from 2023 through the first 3 quarters of this year. So we do know that calls come into the 911 center and they classify them with the information they're given by the caller. And then ultimately, once responders get on scene, determinations are made about what the actual call type is. And so we do expect a little bit of difference between those data points, but it does appear that we might be heading in a positive direction. It's probably too early to really put a trend on it, but it definitely has, kind of a positive direction at the moment. That's not to say we're in a good place. It's just that where, the data is trending in a particular direction. There's definitely still challenges within our community around overdoses. We were fortunate that many people were trained in Narcan in 2023. That's kind of fallen off in 2024, in part because we didn't have a prevention provider. So hopefully those will pick up again as well. But our other partners have continued to train folks on Narcan use as well. So there's a lot of effort, going on that front. And of course, you're all aware that we're working with Cuyahoga Health Systems to get the Trip Hammer Road detox and stabilization facility up in operation, which will hopefully provide a place for folks to get entry into treatment when they're ready to, and hopefully have a positive impact on that as well. Kind of just one other piece to mention, there had been question by this committee about an opioid task force, and we are still efforting that for you. The substance use subcommittee has actually done quite a bit of research about different opioid task force, and we've gathered in other counties, and we've gathered information, and at their next meeting, they're going to be looking at that information and likely making a recommendation to the legislature about how to approach that moving forward. So just wanted you to be aware that that work is continuing, and we hope to have a recommendation relatively soon for you. That's all I have at the moment. I'm happy to answer any questions anyone has, Sean.
Any questions? Randy Brown?
Yeah, thank you, Frank. When are you hoping the detox and stabilization unit would open?
So the substance use piece, the detox stabilization, is on about a 6-month runway to get operational. It requires the hiring of staff, getting contracts in place, getting a lease with the Alcohol and Drug Council to take control of the building, as well as licensing through the state. So there's still some steps that have to occur. So we're imagining about 6 months. The intensive crisis stabilization, which is the mental health substance use combined component, is probably first quarter of 2026, because there's some construction that will have to occur at the building to make it compatible with licensure, including a separate entrance for children and youth, and creating some additional clinical space out of what is currently meeting space. So that is targeted for the first quarter of 2026.
Great, thank you. Also, the Alcohol and Drug Council was in one of the floors in the mental health building on Green Street, and I assume that's empty over there. Is that correct?
It's empty of people. It's not empty of stuff. The Alcohol and Drug Council is still working on cleaning out the space in preparation for turning it over back over to the county. But there's not currently anything operating out of that space.
Okay. Do they have an active lease? Are they paying any rent, or is it just their stuff's in there?
I'd have to defer to the county. I know for sure they're not paying any rent at the moment, but I don't know as far as the status of the lease. That's done through county admin.
Okay, I'd like you to tour that area at some point, and I'll talk to Arel about that, but thank you.
Yep.
Other questions? Frank, I was looking at the newspaper the other day and noticed that there was one of our constituents passed away from COVID, and I was wondering if you could tell us about if you're seeing COVID cases right now, what the recommendation for vaccines is, and share a little bit more about what's going on.
Yeah, well, we're kind of coming out of a peak of COVID. We do have a new data chart that we're sharing weekly that kind of compares previous years to this year, so folks can kind of see where the peaks and valleys have been. We had a pretty rough beginning of the upper respiratory or respiratory illness season here over the last few months with COVID. There's also some other illnesses running around. I'm still recovering almost 2 weeks in from what was a pretty significant upper respiratory illness. It was not COVID. So there are things out there that are impacting people as well. We do still recommend that folks stay up to date on their COVID vaccines. They're widely and readily available in the community at pharmacies, as well as their flu vaccine, right? We're in flu season and we have not hit the peak of flu season yet. So we would highly encourage folks to get that vaccine as well.
Thanks, Frank. We appreciate it.
Thank you.
Okay, next we have, I Actually, why don't we do our minutes approval, and then we'll go through department updates in case someone needs to leave. We have two sets of minutes, the September 18th, 2024, and November 7th, which was our special meeting. Can I have a mover, please, for the minutes? Susan Currie, and seconded by Amanda Champion. Are there any questions, comments, changes? Okay, all those in favor? That's unanimous. Thank you. Okay, next for departmental updates. JR from Veteran Services had actually written me, and he is away at a conference, so he will not be joining us today. I see Kit Kephart from DSS. Hi, Kit. How are you doing?
I'm good, Shauna. Thank you. I don't have a whole lot to say other than I think everybody is well aware at this point that we are busy trying to set up shelter and get things ready to go next week to officially open the Code Blue shelter. And we are working currently on next steps with regards to the THA shelter that we're hoping to be able to also have a more permanent site for. So working hard, trying to really, get everything done that needs to be done. We are working to try to work with our partners and see if we can bring partners in from private agencies to provide training and helps that I think will be very, very helpful for staff. I also want to just kind of give a shout out here to the many county departments that have really gone way above and beyond. I got to say, Dan Cornell and the swap crew through probation took load after load after load out of the St. John's building and put them into storage and managed a really big job of moving lots of things. Many other departments, facilities, IT, a whole bunch of departments have really done a tremendous amount of work in addition to DSS to get things up and running, and we're not done yet, right? We still have work to do. So the work continues. I just want to thank everybody and thank the legislature and administration for all the support because we couldn't be making this happen without that. So just feeling grateful for all that help.
Great. Thank you, Kit, and thanks for your work and your staff's work, and to everyone who came together and under the time frame and all the adversity that I know you faced while trying to get this up and running. So I appreciate that. Any questions or comments for Kit? Okay. Oh, Randy Brown?
Hello, Kit. We heard from a lot of constituents in public session, as well as by email, and I've gotten phone calls. I also got a phone call from a local church, and they're all asking how they can help. I think that's a really good sign that we have a lot of people that really want to help. The particular church wanted to see if they could be a warming center, and then they realized pretty quickly that they had concerns about liability and how they would manage it and those kinds of things. But I really hope that we can start a new chapter of how we can cooperate better with more nonprofits and people that want to help. So thank you.
Thank you, Randy. Okay, Kit. Thank you. We appreciate it.
Thank you.
Next, we have Lisa Monroe from the Office for Aging.
Hi there.
Hi, Lisa.
I don't have anything to report today.
Okay. Well, thank you. Any questions for Lisa? Okay. Thanks so much. Appreciate it. Next is Kate Shanks Booth from Youth Services.
Yes, good afternoon. Not so much in the way of reporting, but I did, as we've seen and we know, homelessness continues to be an issue. And I just want to commend my county colleagues in the legislature for what you've been able to do in a short amount of time. I also just want to ask that we remember that we also have youth who experience homelessness in Tompkins County. 18 and under is a segment of population, then also 18 to 25 years of age is a population. As you're aware, we've had some issues with local providers being able to meet the needs of our youth. And so this has not gone unnoticed, and our department is planning to pull together some community partners and other folks in early December to start to have a conversation about ways we can do things a little bit differently, maybe think outside the box, and there will be an invitation coming to those legislators that might be interested in participating. So just a heads up that that's coming, and know that we're working on it, and just want to bring that to your attention.
Thank you. Any questions for Kate? Okay. Kate, have we heard back from HUD at all in regards to the housing of our younger people through the village?
I am not aware that they have had any communication beyond what they were already given. I do know that they're waiting for that to come back. There was some correspondence that came today from Office of Family and Children's regarding that in order for an agency to house those youth in a residential format, they need to be certified. And so I can discuss that more with you offline if you're interested.
Okay.
But as far as HUD, I'm not aware. So.
Okay, great. Thank you. Okay, next we have Reverend Ken Clark from our Office for Human Rights.
Good afternoon.
Hello, Ken.
A couple of things. OHR participated in and organized 3 events during October related to the debut of the documentary on immigration that I've discussed here in prior meetings. The documentary is called Are We There Yet? A Compassionate Exploration of Contemporary Migration. And it was really a campus community collaboration between Cornell and OHR, the Human Rights Commission, and others. The first of the events was a faculty staff roundtable that was at the Johnson Graduate School on October 18th. The second was a screening with 30 students in the Dyson School of Applied Economics and Management on October 21st. And the third was the public premiere of the documentary that was held at Cinemapolis on October 24th, which drew about 80 people. Each of these events were well received. And Tom Hubble, who wrote, directed, and produced the documentary, has entered it into several film festivals to attract additional interest and traction. So overall, we had a very good reception publicly for this program, and I think it's all the more important in light of more recent events. On November 3rd, 2 days before the election, we held an event called Come Together. It was held at First Presbyterian Church. It was co-sponsored by the Human Rights Commission, our Civic Engagement Coalition, called Your Voice and Your Vote, and a number of other community organizations. There were 3 panels held during that event, which lasted from 3 to 6 p.m. Panels were held to discuss the importance of voting. Another one was held on criminal justice reform and reentry for the formerly incarcerated, and women's rights and their intersection with other marginalized groups. And we drew about 50 people who stayed, most of whom stayed for the entire time of the event. A number of the panelists included, for instance, for the voting panel, retired Cornell professor Margaret Washington, excuse me, and for the criminal justice and reform and reentry, Thomas Kelly, the police chief, and Tally Mugambe were 2 persons who were panelists, along with Reverend Terrence King of St. James AME Zion Church. And thirdly, a number of several persons from the League of Women Voters, including the person who is in charge of the New York chapters of the League of Women Voters, were participants in this event. And so we did this in an effort to really honor and seize the moment just prior to the election to provide a way to have a public forum that would address some of the issues either implicated by or impacted by the upcoming election, which was 2 days later. So just those things from us.
great. Thank you very much. We appreciate it. And also we have Cindy Wilcox here from the Human Services Coalition. Hi, Cindy.
Hi, Shauna. Thanks for having me. I apologize. I'm getting over something. I have a quick announcement. I want to invite you all to the December 6th Community Health and Access Committee meeting. It's from 12 to 1:30, and I believe it's in the Tompkins County Library. The Community Health Access Committee is a subcommittee of the Health Planning Council, and they kind of monitor emerging issues that are impacting healthcare access. And we have Mark Ropecki, who is the CEO of the Care Compass Network, that will be there to talk about the New York State Medicaid 1115 waiver. I'm sure many of you are extremely seasoned in this. Some of you may not be, but it is a really good opportunity for kind of a level set for our community around what the Medicaid 1115 waiver is, which is actually a program that is working to kind of increase health equity and reduce health disparities for folks who receive Medicaid. And it, what that means for Tompkins County, what that might look like, what organizations could be involved in that activity. So basically, it's really about the purpose, the intent is to kind of build the social care infrastructure to better support those social determinants of health or those social care needs that have historically not been invested in or reimbursed for. So this pilot is helping to kind of build that infrastructure and recognize that it is important in healthcare. Anyway, so I'm inviting you all to that. It's an open meeting, and it should be a really great Q&A.
Cindy, any questions for Cindy? Okay, well, thank you for attending. Are there any questions or comments from our committee members? Susan.
Just wanted to report that the Human Rights Commission has been really organizing themselves to help with the shelter. They reached out, they put together a list of questions, which I sent to Lisa, and she very kindly responded. One of the things that they wanted to do was to put together a pantry of personal items for people at the shelter, and they also toured the shelter when they took the opportunity. And so they will be working with, I forget her name, the new shelter, the head of the shelter at this point. So they're really doing a great job of trying to stay within the guidelines of helping, but really wanting to. One of the things they were particularly interested in was teens who finish school and then there's nowhere to go. So trying to figure out something for that, although perhaps a warming center might be the option for that. But I especially appreciated their thoughtfulness and how they went about it.
For our Human Rights Commission, they are doing some really incredible work, and we've come a long way from 6 years ago.
They do.
It's refreshing.
Reprogramming. I think I mentioned the Unmute Yourself, which was a Zoom conference about health issues that women encounter. It was very well attended, very interesting. Wonderful. And I think they're going to try to do more of that.
That's great. Very good to hear. Great. Anyone else? Okay. That's our meeting for today. Thank you all. Have a good one.